Okay, it says connecting. So I'm going to check just to be sure that we are live in all the places. And
Uh-oh.
you okay?
Dang, it's stuck.
Let's see. It says it's streaming. So let's check. Hmm. I may have to go live on my phone. Oh no, cancel. It's on there. All right. All right. Don't be nervous about anything. We're just going to have fun, do what we do, express ourselves. We're going to let folks get on in. And I'll let folks to get on in here. I just want to make sure that everything is working. That's why we're on before 7. Um, all right. There we go. So I'm just checking all of the channels. We still have like 4 minutes. Let people log in. And let me check LinkedIn and see what it looks like. Ah, I can see it on LinkedIn. It says it's live. I think that there's a, oh yeah. All right, yeah. There's a slight lag,
Mm.
but yeah. So then I just want to check LinkedIn one more time. So yeah, we can continue to talk. Sis. I mean, we got 3 minutes before we start.
Okay.
You know,
How are we looking on audio? You were mentioning that there was a lag. Is it a lag in video or audio?
it's a lag on the live streams.
Mm.
So I'm looking at LinkedIn. There's a lag.
Okay.
Welcome everybody. We're gonna get started at 7 o'clock. We can get started on time. This is us making sure that we have the correct audio. We are making sure that we're doing sound checks. When we show up in a space, we cannot show up halfway. That's just not going to work. So I just want to make sure that everything is everything the way it needs to be. And to everyone who I have given the link to, that is not the correct link, right? So hey, this is like Disney. Remember when Disney first launched and they just was like, we just gonna put it out there, and however we're gonna figure it out along the way. That's what we're doing, right? This is life, okay? Not perfection. This is greatness. I'm gonna let Rochelle in and let her know. Hey Rochelle, I gave you the wrong link, my love. Just go either to TikTok or
Okay.
to
LinkedIn.
or LinkedIn. Yep.
Okay, I'll do that.
Thanks, sweet. Yeah. So it says it's live on TikTok, but I don't see where. Can someone in the live stream let me know if you can see it on TikTok? I can see the chat on LinkedIn, but I don't see it live on TikTok.
Don't you just love these technical difficulties?
Yeah, I mean, listen, we're recording, so it'll be fine, right? Oh, it's a bunch of people joining. I don't know these people.
There's I know few folks I've told on my side too. So
Yeah.
so
Yeah. Yeah. We'll figure it out. All right, sis. It is 7 o'clock. How you feeling?
good, doing good. How about you, Doc?
Very well. So we're gonna hop into this conversation. One, because it is 7 p.m. It's also 8 o'clock your time. And we really want to have a targeted conversation. We want to be on time. And to be on time is to be before time, and any other time is late.
That
So we
part.
want to be conscious and conscientious of things. We want to set intentions about what is happening tonight. So welcome to Hijacking Equity, episode 1. We're talking about mental health. I have a very special guest here tonight. Very honored for this sister to be here with me. She's just amazing and has made me proud over the years. It's been almost 10 years since I have known her. My name is Dr. Aurelia Johnson. I'm your favorite sociologist and the identity professor. Again, this is Hijacking Equity Live, and we have our special guest, uh, Miss Zahiyah Frazier. Yes, ma'am. So I'm gonna let Michelle in, and then I'm just gonna let her know what's going on. Yeah. So listen, you know what? We are going. We're gonna
Go
do the
ahead,
thing.
jump. Go ahead, jump into it. Cause
Yeah,
I see you ready. So go ahead.
I'm ready. I'm ready. We're gonna do the thing, right?
Do the
We are
thing.
doing the thing.
Do the thing, girl.
So first thing is I want you, so the individuals that are here in the stream with us is because I gave you the wrong link, right? So you can stay off camera or you can join on LinkedIn, but we still want you to be a part of the conversation. I thank you so much for logging into this first episode. We're learning how Restream works. I'm not going to apologize for uh, trying to get the kinks out, but this is what we're going to do. This is what we are doing, and so we're here. So we just ask that you stay off camera and stay on mute. All right, so here we go. So first thing is this is called Hijacking Equity, and it is in reference to the upcoming book that I have. And it's called Hijacking Equity: A Practical Guide to Language Liberation and Leadership. And the concept of hijacking equity is really about the conversation that is happening in the current social milieu, meaning that, DEI has now become a pejorative. It is something that is negative. It is uh, slang that is being used by a particular group of people that have a particular ideological background, understanding, position. And my response to that, especially being an equity practitioner, really a social justice, anti-racist, pro-black practitioner, is that we have now need to understand the evolution of equity. How do we get to this place of DEI? And then how do we get to this place where people are now taking something that means to meet the specific needs of specific groups of people in order to level a playing field? And now that you're using it in spaces of it is reverse racism against, the empowered minority. It is a term that is being thrown around when we're talking about reverse racism or MEI, right? This whole meritocracy conversation. And so I want you to tell us about who you are, and then we'll jump into how hijacking equity is now in this mental health space.
Mm. Thank you very much. First of all, thank you for having me, first and foremost, and welcome to all those who have entered the chat. My hope is to be able to kind of talk about hijacking equity from the space of mental health and just introduce myself. I'm Zahiyah Frazier. I am a licensed professional counselor for almost 3.5 to 4 years now. Um, Basically, my specialty is in trauma, relational building, as well as race relations. And the whole conversation about equity definitely has filtrated itself into our spaces of mental health. But it is a really fluid conversation for a plethora of reasons. So I'm just looking forward to having a conversation of how we can go across the gamut to even like dissect the importance of this conversation and how people could take it home. And even if they are receiving mental health services, how they can actually think about it in terms of how they approach their own therapy and their own self growth.
So I am loving everything that you said. So let me date myself a little bit. Actually, even though she's a little older than I am, Zahiyah was a student of mine at Trinity University when I was teaching college, and she was in my sociology classes. And I knew that there was
Three,
something
three,
dynamic.
three of
Three
them, by the
classes?
way. Three
Yes.
of
I was teaching all the classes.
all over the
And
place.
I knew that there was something special about you when I met you, the kind of conversations we were having. And even though you are, older, you never, um, there was never any time where I felt like I was being disrespected because I was younger, right? Or
Sure,
that ageism was at play in any kind of way.
sure.
So I, one, will say thank you for being an amazing student. I'm extremely proud of all the things that you have been able to accomplish, all of the challenges that you were able to leap over, go through, go under, go around. And just to be here in this space with you it's a gift. So I just want to be very, very, very explicit and emphatic when I say that it is a gift being here with you.
Thank you so much.
So
Thank you so much
yes,
for all of that. I accept and receive all of that.
I love it. So now we're talking about hijacking equity, right? You are a mental health practitioner, right? And you come in with a very different kind of lens. It is intersectional, it is communal, it is collective, collaborative. It centers identity while decentering white supremacy. So tell me about that.
Well, the thing is, okay, and I'm gonna try to keep this as simple as possible because what I don't want the chat to do and leave with this conversation is feeling more confused about the lens of mental health and how it infiltrates a lot of these systems. I want you all to leave this conversation with a sense of knowing that you have the power to be able to know and spot and be able to do kind of like selective thinking and learning when it comes to mental health, how you choose your mental health, be all right with questioning these things, especially when you're dealing with these systems of equity.
Mm,
Now, to answer your question, Doc, yes, it's communal, but it's very nuanced. It's very nuanced. And what we need to be careful of in terms of having these conversations is not making it primarily about the thing here. Because the
mhm,
thing with mental health is, yes, this has a lot to do with the conversations we need to have when it comes to self growth, but we need to take the systemic thinking out of these conversations and focus on the human. And
mm,
where becomes a problem is that we're no longer, even the practitioners are no longer focused on the humanism of mental health, but we're more so living in what the job of the gender is or what the job in terms of what society means. And with those particular conversations in mind, it filtrates into things like, well, what privileged white people have versus black people. It changes the entire conversation, right? So I feel that in my space, especially when I take on a client with in regards to race relations, I have to make it very clear that just because I look this way, because I know what the human mind thinks sociologically speaking,
mhm.
just because I look like this, it doesn't mean that I don't have your best interest at heart. And so it does take a level of me as a practitioner breaking those walls down with a client, especially if I'm dealing with like a white male, um, to let them know, hey, you are also in a safe space, because at the end of the day, right, we're trying to break those walls down in terms of making it about this isolated thing. We're talking about overall health. This is not a black thing. This is not a white thing. This is a human thing. And because of the fact that with all these conversations going around, sociologically speaking, uh, it does make the conversations hard to make it human again, if that makes sense.
Absolutely, absolutely. So we're gonna get into. I think I need to caveat from what you just said.
Mm,
I, tell me, tell me your approach, right? So you're talking about the differentiation in how people respond to you because of how you look,
mm,
right? And then you're talking about how others are responding to the mental health system as a whole.
mm,
And then I heard you say that you're operating in this gray area, like this very nuanced space where you are having to, one, say, I don't want to have to dignify my humanity. I don't feel like you need to dignify your humanity. And then I don't need you to dehumanize me as a practitioner, because then when I show up in this space, I look very differently. Is that what I'm hearing?
That's correct. But a lot of that thought right there that you just landed on, I feel like I have to defend myself to other practitioners on that thought, not so much as the client to practitioner experience.
Mm-hmm.
Now, if I'm dealing with a subject in race relations, because a lot of our equity conversation kind of lives there, I find, at least in my time, that more people that don't look like me are more eager to have those tough conversations because they feel safe enough to do it. They
Mm-hmm.
feel like they're in a safe space to mess up whatever language or linguistics they've been taught to say. They feel like they're in a safe space to be able to get it wrong. Versus folks that look like me, where there is some sort of combative attitudes because of how we've been conditioned to think and to survive, right?
Mm-hmm.
So but in more corporate spaces, like if I'm trying to implement some sort of therapeutic services, or at least giving perspective about like the pulse of a staff or whatever the case may be, I am often met with challenges on things like, hey, maybe we need to, they love to frame things to keep it real cookie cutter cut, really HR friendly, that type of stuff. You know what I'm saying? I
Mm-hmm.
hope that makes sense.
Yeah. So tell me this, right? Let's take a step back
Yeah.
just a little bit. Tell me about how equity shows how is well, tell me how equity is being defined in the mental health space
Mm,
first.
mm. In my time, it's a very fluid conversation, because when we're talking about equity, you and I had a conversation before about people not knowing the difference between equity and equality.
Mm-hmm.
So the thing about equity, right, and how it shows up in the mental health space, it's one of those things where it depending on who my audience is and from the practitioner's perspective, it depends on their specific discipline too. If I'm in a space where I'm dealing with like trying to find out the root cause of a person's behavioral crisis or whatever it is in terms of what's bothering them, what trauma and where does that live? If I'm trying to get to a root of a problem, right? The last thing I'm thinking about in terms of whoever my client is what's fair to the Black person or the white person, right? I'm thinking about to what's fair to the human. So there's not really a conversation on what's fair, what's not fair in terms of how I work with my patients or how I work with my client, because they're coming to me with open arms for the most part, because they are at their wits' end. I've tried everything that I could do on my end and I need help to get to this particular thing. I don't care what you look like, lady. And
I
so
just need
they're,
your
they're
help.
like, I don't care what you look like, just help me. And
Yes.
so if I resonate with a client to where they feel that they're being seen and heard and felt, and then I'm also providing them the tools for them to be empowered on their own, it's not even a conversation in terms of equity, right? But where that does live, however, is in corporate spaces. Corporate spaces is where I find those conversations, and how that looks, Doc, is, do you think it's fair that you might talk about DEI with a predominantly white in a predominantly white setting as far as a board meeting is concerned? Like things like that is where equity lives. When it comes to just kind of being more performative for political or capital gain, not when it comes to the more boots on the ground conversations, when it comes to imano to imano, when a regular degular human being is looking for some other option other than what they have had, right? So it could get really murky depending on the audience to which I am performing in front of, if that makes sense. It can get real murky. If I'm in corporate spaces dealing with HR, dealing with staff, and doing consults with companies, that's where those equity conversations kind of sort of live. And they never show up in terms of the betterment of the person or the employee or just whoever we're serving, if that makes sense.
I feel like that was a really safe answer.
It is. It is. It is. It is.
Right.
But it's a truthful one,
Yeah.
nonetheless.
Yeah, I do. I get that, right? And I also get that we have to be conscious and cognizant of how we show up in spaces, especially when we're showing up publicly, right?
Mm-hmm.
And
And,
you
and
can't always,
credentials are behind you. Yeah.
yeah, and so we have to be conscious and cognizant of how we are being received, how receptive individuals are, all of those things. But
Mm-hmm.
what I think I'm asking you really is, when you're talking, when I'm asking, is equity in the mental health space, is there an equitable diagnosis in depression, in bipolar disorder, in anxiety, in generalized anxiety disorder? Is there an equitable um, access to resources,
Oh,
right? Like that's what I'm asking about. What
sure.
how is equity showing up in this space?
Sure. Okay. Thank you for clarifying that. And to give you a fine print on that answer, yes, absolutely. There are nuances in our space where you do have resources in terms of different spaces and places in terms of equity, and how that does show up in terms of like who you can reach out to for LGBTQ plus things like ageism and disabilities, autism. There are therapists who serve primarily for those communities. There are even race relation therapists, people who serve as Black folk in terms of PTSD, and just being Black in America. There are specializations for LPCs, psychologists, psychiatrists that are predominantly servicing those particular areas. So yes, there are definitely spaces for that. As far as race relations is concerned, they're very far and few that actually jump into the bowels of race relations. But I guarantee you that they are out there. And how it shows up is just like, for example, I do race relations and I work with a lot of white males in terms of discovering one's whiteness, ironically me. But the
Mm-hmm.
thing is, how why I feel like why my experiences with white men tend to work out on the positive end is not only because I'm showing up as a Black woman, but the way that I present resources for them to learn, it seems palatable for them to be able to say, hey, let me gravitate to this thing so I can learn about what it is I need to learn. So even for them,
Mm-hmm.
there's equity for them as well. So there's across the spectrum in terms of any human being from any cultural space, from any dynamic space in terms of diversity and inclusion, there's a space in mental health for them. Yes.
Now, so this is what I heard you say. I heard you, in essence, say that equity is just not pro Black. I heard you say that the usage of equity is not about limiting resources to a particular population of people based off of their social identities, whether it's ethnicity, nationality, gender, sexuality, sexual orientation. What I heard you say is that there is a space for race relations when it comes to the reconciliation of identities.
Right.
When it comes to privileges, whether you recognize those privileges or not. Is that what I'm hearing?
You are absolutely spot on. Absolutely. I
Now,
mean,
let me. Okay, go
oh, I'm
ahead.
sorry. Go ahead.
No, no, go ahead.
I was just simply saying that it looks based upon what our lens as individuals present to us, right? If we are not, what is not accessible, let's just say that, is the whereabouts of how one can access that information or those resources. So, for example, while there are therapists that are actually here to help folks through those particular issues, it's not exactly on your www.psychology.com pages for you to just say click and I have this particular person. You got to go digging for these things, or you got to know someone that knows these things. And that's where the messaging can get a little murky in terms of equity and access, right?
Mhm.
Like, why is that not out there as quick as like BetterHelp, you know? And so I think we do as a field, we do need to be better at how we market ourselves for those nuanced conversations, even though it isn't nuanced, but that's how the world wants us to look at it. well, what do you mean race relations? That's not a thing in therapy. What do you mean PTSD for Black people? That's not a thing. It really is a thing. It really is a hard body thing and a hard body practice that actually has research behind it.
Mm-hmm.
So, in order for us to really get that narrative out there, we kind of in our field we need to be a little loud about that. But that does come with some sort of a consequence depending on one's audience.
So I want to stick a pin in a couple of things that you said. First, I want to talk about the race relations component.
Mm,
No, second, I want to talk about that. The first thing that I want to address, and I want this to be cleared up a little bit.
mm,
So historically, and even like right now, accurately, right, there is a disparity in accessibility,
sure.
right? So when you're talking about access to healthcare, when you're talking about access to services, right? When you're talking about access to income,
Mm,
jobs that provide you with healthcare that would then allow you to have the opportunity, that was a long way of saying that, but
mm,
to have the opportunity to go and see a psychologist, a psychiatrist, a counselor, a therapist, to access EPA, right?
mm.
Right. So we know that there's a disparity there. So are you what you're saying, are you saying that you're acknowledging that disparity and acknowledging at the same time that there's still resources for people regardless of how they physically show up?
I am saying that while there is a disparity there in terms of how we access those resources are there. There's
Mhm,
a difference between the how and actually whether the resource has been created. The resource is there, right? But the
mhm,
thing is, because we are not able to market this without some sort of recourse behind us, or some sort of backlash of some sort, without being looked upon as, oh, you're anti this, it becomes a little difficult to, we can't get on a mountaintop and say, hey, there's actual therapists here for race relations and wave our hands up, right? I think we can. I just think there's a lot of fear behind that because people are afraid to be canceled. People are afraid to be looked upon a certain way. Some people are really afraid that they won't get the clientele that they're looking for. There's various reasons. So the resource is there. It's just the how, the getting across the bridge to get to that resource is the problem. So to your point, it is the and. So I am acknowledging that there is a disparity of how we access the resource, but the resource is there.
mhm. So now let me caveat, let me springboard from what you just said,
Mm,
because the second part that I wanted to address is this race relations component.
mm.
So talk about what that means exactly, right? Is it race relations in the ability to access the appropriate type of diagnosis and intervention? Or are you saying the race relations and being able to trust each other? Is it race relations impacting how the therapist sees the humanity in the person that they're serving, or that the client is being able to see the humanity in the person that they're relying on? Like, talk to me more about race relations.
Okay, so give you a fine print layman's terms on how this really goes at the end of the day. Like the overarching theme for race relations is, if we're looking at it from the lens of a person that is white, specifically a white male, if we want to put a finite point on who we're dealing with here, hey, I was told to take a sensitivity class and I was referred to you to talk about sensitivity issues in terms of how other people look and diversity and inclusion.
Mhm,
And we go through the level of questions there, right? Or it could be white male, hey, in light of George Floyd, I noticed some things that my family is doing that I don't feel right about. And so, I had a friend refer me to you, and I was wondering if you and I would be able to talk. And because I'm not really sure how to think about these things, and I kind of sort of need a safe space to speak on it. Another example, white woman. What do you mean crocodile tears at the workplace? I am with Black women. I am trying to support Black women. I'm trying to figure out what it is that I'm doing wrong. I just wanted to feel Keisha's hair. What is wrong with that? These are questions that I get that there is absolutely no knowledge of how that works. They don't understand what a microaggression is. They don't
Mhm.
understand how that they are conditioned to do these things based upon how they were brought up, what they were taught, what the systems suggest that you should act like, right? So when a person comes to me, there is already a light of discovery there for that person, right? And they already know that there's an underlying issue that they need to attack. And so we start from the ground. We
Mhm.
start from, hey, how did you grow up? Hey, what was this like in your family dynamic? Now, in the Black community, it's a little different, of course. There's race relations in terms of colorism that I talk about. You know, there's conversations in terms of the Black elite that I talk about. There are things in terms of the nigga mentality, house nigga versus the field nigga
Come
mentality
on.
that I
Come
talk.
on. Come
You
on.
know, so when you're talking about this type of therapy, and this is why I don't do couch therapy, and this is why I'm not out there for everyone to access like that, is because I know my language can get gutter, but I know at the end of the day, I know at the end of the day, if you really need the help to understand your human self, if
Yes.
you really need to understand your human self, I'm not here to solve your problems, baby. But what I can do is I can at least guide you on where you can find the answers for you. That's race relations.
So for the audience, I just want this to be very clear. First of all, I need you to tell these folks where they can find you right now.
You can find me at She Is Z on Instagram. And that's the best way to get in contact with me because I do most of my therapy pushes there. She is Z on.
And I think that this is extremely important, right? So when you're talking about race relations, you're talking about it as a therapeutic tool.
Mhm.
You are talking about it as a way of getting people in a space to understand their advantages, their disadvantages, their privileges, their scribe status, their achieved status, their the intersections of their identities, right? Because you didn't mention misogynoir, but we know that that's a
That's
thing,
a thing.
right?
It's a thing.
Right.
It can.
Um, you talked about like black elites, right? And so Frazier is behind me, right, with black bourgeoisie, right? And that's most definitely Fanon when you're talking about black skin, white mask.
Mm.
And so what I'm hearing you say is that ideology has done um it has done a number on everybody.
Oh yeah. Oh
And
yeah.
that in your realm, your specialty is helping people get through that.
Not just get through it. I need you to understand where you messed up. I was about to cut.
Mhm. I need you to say what you feel and feel what you say, okay?
I want you to understand how you messed up. And I don't mean that in a negative way. I just I want everyone to understand how in some form or fashion, all of us have had our hand in the pot of being complicit because we've
Mhm.
been conditioned. We've been
Mhm.
conditioned. The problem is that we think that we as because we are the oppressed, that we don't have our hands in the pot, right? But then when
Mhm.
we get to the conversation of colorism, don't nobody want to talk about that, right? And so when like when it gets to the black problem, beyond the black problem in terms of the surface conversation that everybody knows, like slavery and Jim Crow, once you get into the nicks and crevices of the black problem, don't nobody want to talk about that now because that's different. What do you mean? You know, like it people get a little triggered, and so my job is to live there.
Right.
I live in the gutter there because if you really want to do the work to get past the ideology, that is the only way that the isms will fall because you have to any it's like mob mentality. At the end of the day, everybody has to understand and be able to speak where they were at fault.
Mm.
You know, in order for us to dismantle the ism, we have to first admit that we are a part of the ism, not because we woke up one morning and said, you know what, I'm going to be a bigot today. That's
Right.
not how that works. We have been conditioned, indoctrinated, and in practice to be these things to each other at different levels. It is
Yes.
ingrained in our systems, in
Yes.
every system you can think about. So when he asked the question, they being white folks, why is it always about race? Because it is.
Mm.
All of this stuff has been ingrained in every system that we globally, not just here in America, globally. It's embedded in our money. It's embedded in our linguistics. It's embedded in all of that. So until we can recognize it, then we won't know how to stop it. So I live in a place of recognizing, not just helping you get over. Does that make sense?
Yeah, and I'm also hearing what you're saying is this is about reconciliation,
Mm,
right? So not only do you need to recognize, right, but in order to address, you there has to be some reconciling, right, with the self,
mm,
because this is
that's number
you sound like my student.
that's number
Because one of the things is we have to understand what socialization has done, right? Remember
mm-hmm.
in class, I used to do the illustration in elementary school when we had, if there were centers
Yeah.
and we were sending students to centers, and centers were very gendered, right?
Mm,
And so how we're teaching gender in that context,
mm-hmm.
when you are tiering the school,
Mm,
right? You're teaching class and social stratification that way.
mm,
When you see more Black children, specifically Black boys,
mm.
being labeled in special education,
Oh
and
yeah.
you see more, non Black boys that are in honors or the gifted and talented program, or even less when you get to the international baccalaureate program,
That's
right?
the educational racism. Oh,
Absolutely.
yeah.
Absolutely. So now when we are in this space of socialization as well as psychological conditioning, both operate in classical, right?
Mm.
Tell me one of the things, what are one of the things that you use to bring that out in a conversation?
Oh, that's a really easy question, Doc. I take it back to the human level. Like the thing is, and I hate to be this guy to say this. I hate to be this guy, but this is I'm just speaking from a lived experience. I've worked in healthcare for quite some time. And it has been my experience that when it comes to an issue, like especially when that whole George Floyd situation happened, they often called me to speak in white spaces. It is me being palatable that they like,
Mm,
right? And so, in order for me to get anything out of any human being, I have to not think about the thing. I have to go into the feeling. So, in order for me, and I'll just keep it real chill and real simple. If I see that a human being is sad and I
mm,
need to know why that human being is sad, I am not going to lay on the fact that you are sad. I am going to say, how was your day? I'm going to have you lead me to the point to which you were sad. How I get things out of people, especially when it comes to race relations in the psychological space, I'm asking you about you.
mhm,
You know what I'm saying? Because that makes me more palatable and easy to ingest to that other person. Okay, this person's not trying to attack me. This person is not trying to make me feel bad about being who I am. They're really just trying to figure something out, and I think I want to engage. I start there.
mhm,
And then I probe with the right questions, not just based on what they say, but the body language in which they show. If I find that a patient or a client is getting a little fidgety when they're talking about something, when I ask a difficult conversation, I'll ask them, walk me through that fidget right there. Tell me what you're feeling right now. See, being this way, I am not attacking the sociological problem. I'm
mhm.
getting there, yeah. But what I am doing, I'm taking you to the human space first because
Good.
you need to know that I
Mhm.
come unarmed. I come with
Good.
I come unarmed. I come with the intent to resolve. I
Yeah.
actually not just resolve, but I'm trying to help you resolve your inner stuff. You know, I'm helping you resolve, white man, why you feel so triggered, why you feel white guilt, because I see it on you.
Mhm.
But I'm here to let you know that A, it's okay because you've been bamboozled. You've been
Absolutely.
conditioned. You've been run amok. But I'm here to let you know that I'm gonna walk you through it. I'm gonna walk you through it. That's how I get that out. If that makes
Mhm. Absolutely. So you go in, one, some people are against this term now. I really don't care, with your magic.
sense. Mm,
And you have then you're using that magic and your power
mm,
and your expertise and your presence to disarm. And then once you have disarmed, which meaning you are making these folks take all of the stuff that
Mm,
has been put on them, placed on them, right?
mm-hmm.
By the, the all the social agents
Mm-hmm.
right around them and the socializing
That's
agencies,
it.
right?
That's
And you're
it.
saying, no, 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 put all of those things down. We'll pick up those things later at the time that we need to. But right now, I just need you to bag lady, you know what I mean? You're gonna
Yes.
hurt your back. Put that
Yes.
down.
Yes.
Let's have a conversation one on one. I
Mm-hmm.
am not trying to, I'm not trying to um what's the word I'm looking for? Not diagnose. Yeah, I'm not trying to diagnose the symptoms. I'm actually trying to diagnose the problem.
Right. I'm trying to get
Yeah,
to the root of how you got to the problem, actually, because
absolutely.
every and see the thing is, for me, from the therapy space, every problem has a root.
Hmm.
I live in the gray for a reason. You brought that up earlier. I live in the gray for a reason, and I do it on purpose because when it comes to the human lived experience, nobody's all right, nobody's all wrong, right? So if you
Hmm.
tend to live in the gray, you kind of get the perspective of both right and wrong and learn to respect them both.
Hmm.
That's where you find resolve. You find resolve in the gray. You don't find it by choosing a side because you didn't wake up one morning and decided this is what you were going to be. Now, if you knew the way to get out of it, change your thought, it would be something that everybody would do. It ain't easy to change. Do you understand what you are asking the psychological being to do when you're asking someone to change their mind based upon what their belief systems are? It is
Right.
a lot. It is a lot. And I know if people out there in the chat, I understand how a lot of black folks feel, white people, they know what they doing. And to a certain degree, you might be right. But the thing is, before I assume anything, I'm going to take you to a human space first. And then we're going to walk you through. We're going to
Hmm.
walk you through, right? And until I get to the point where I really know what's going on, and whether I know that you really want to change and whether you really want to kind of do the work to be able to be a better person, I'm not going to assume that the worst about an individual. Does that make sense?
Absolutely. Absolutely. And how can you, again, we're talking about hijacking equity, right?
Mm,
And we're talking about, the pejorative. We're talking about this perverse, distorted, contorted version of what this narrative that is being put out.
mm,
Based off of what you just said, how
mm,
can you take that, what is the word I'm looking for? Not ideology. How can you take that mentality? How
mm,
can you take those tools and strategies
mm,
and help people apply it into other spaces?
mm. By simply having a person understand that before you assign them to color, creed, gender, or anything else that is so.
Uh-oh. I think we have accidentally lost our speaker. Give me 1 second, y'all. Listen, this is technology. This is what happening. As soon as that's the devil, right? As soon as that is evil, as soon as the conversation goes into a place of how we can transfer strategy and tactics, something happens, right? I want, let's see here. As soon as we get into this good conversation, um, this is what happens to us. But I mean, listen, this is technology, right? This is some of the things that happens, and we just gonna keep it moving the way we need to keep it moving. So let me text Zay right now, to let her know that we lost her. Um, yeah. So I mean, what do y'all think? I mean, there's a chat here that you can drop your comments. Please drop your comments in the chat. I can see them. There she is. Whether you are on not Instagram, whether you're on LinkedIn or if you are on TikTok.
Can you guys hear me?
Yeah, I can hear you.
Okay. I don't know what that was. It might be the enemy at work, but you know what? We back.
Yeah, that's exactly what I said. I said as soon as we talk about tactics and strategies and how do we transfer that into a different space, then all of a sudden click.
Click.
Yeah.
Um. So I'm trying to remember where going back to the human space. That is where I live as a therapist, and in most of the things that I practice, from trauma, behavioral development, relational building. You got to treat people as a human being first and foremost before you get into the sociological into the sociological realm of things, right? Before I am a black woman, I am first a human being. Before you are
Mhm.
classified as a gender of any kind, when you pop out, before you are classified as said gender, you are human first, right? And so if I meet you there to let you know, hey, because I think, and this is just in my experience, other therapists may have had other experiences, but it's been my experience that at the end of the day, despite of what folks think, and this could get murky when I say this, it can be
Mhm.
debated, but people want to be seen, heard, and understood at base value, just at the base of everything. You could be the bigot of the century. It is because you live in fear, because you are not understood in your mind, right? So whatever it is that you might be in fear of and you lack understanding of, if you meet somebody that looks like the thing that you are afraid of the most, and realize that, hey, I too am human, and you can get past your own stuff, then we can actually make some stuff work, right? So to answer your question on how to apply it and how people can apply it to their lives, is that you address people at the human level.
Mhm.
You
So in government, address them at the human level. In
hmm
education, address them at the human
hmm
level. Now I'm
hmm
gonna give you some pushback because I hear people in my sphere. I hear y'all out here in TikTok land. I know that the live was cut off. I'm so sorry. And again, it's just what happens. See what I'm saying? It's just what happens when you're trying to do what you need to do for yourself. So what I'm hearing people say is
mm.
that's cute,
Yeah,
uh, soon to be Dr. Fraser. That's cute. I
yeah,
hear what you're saying.
yeah,
However,
yeah, yeah.
right, there is a racialized context that we cannot ignore.
Mm-hmm.
And I do want these people to see me as human. And
Mm-hmm.
I do want to be felt and experienced as human.
Mm-hmm.
However, when I walk into this space, there
Mm-hmm.
are things that come along with me in
Oh
this
yes.
space,
Yeah.
right? That
Mm-hmm.
have that are completely independent of me walking into the space.
Sure. Sure.
So what do we do with that?
I would not dispute that. I will not dispute any of that. I think the thing is, when you have people say, "Oh, that's cute," and so and so and so and so, it is not to negate what's obvious. But the question is not to acknowledge what's obvious. The question is, how do we solve it? Right? How do we solve it? The thing is, it starts with you. It
Mhm.
starts with you. If you walk into a situation, and let me tell you something for context, chat, I have been a victim of racism, misogyny, all the isms in my life. I've been called a nigga at work. It's just been one of those things that has happened to me. If I could still show up in it, because this is how I look at it, right? At me personally. Now,
Mhm.
how other people in La La Land feel about it, hey, we can have that conversation, mano to mano. We can break all that down. But me, in terms of how I feel about the isms being shown towards me, I don't make that my problem. That's yours.
Okay.
That's your problem, right? I don't have to swing left because you swinging left too. I don't have to match your energy because that's what you're doing. However, it gets a little murky when it comes to government and how things are being implemented from the top on down, and how we live our lives, how jobs are implemented and salaries and things of that nature. That's a bigger conversation. But at ground level, right? At ground level, if you, the individual, have the power to actually insert yourself to make a difference by not being what they think you are, you know what I'm saying, you can actually entice a conversation that might shift someone's mind. Now, it's not your job to teach, it's not, but how you carry yourself in a situation can actually entice a conversation. I'll give you a really good example. Every
Because I was
June,
about to say, friend, wait a minute, because that's something like that's teetering on respectability politics. Is that what
I
you're
mean,
saying?
it could be debated, but the thing is, I'll give you an example now. Every Juneteenth, I wear a shirt that sparks a conversation, right? And it's usually something that's mind provoking that somebody white said on Juneteenth. I do it on purpose because if somebody says, "Well, what does that mean?" I remember I wore one year something that Jane Elliott said. It's not education, it's indoctrination, right?
Mm-hmm.
That's one of those things that gets a lot of people talking every time they see the T-shirt. And then they ask who Jane Elliott is. And when they find out that she's a white woman, that often sparks up a conversation right there, especially if that person is white,
Right.
right? So what that does for me, it gives me an opportunity to actually figure out, are you a part of the problem, or are you just you actually want to be a part of the solution, right?
Mm-hmm.
All I'm saying is we can sit here and have the discussion about what a person's true intentions, what their intentions are, but I need you to find out what they are first and not walk in the door thinking that that's what it is, right? Because we can say the same thing about us, right? We can
Right.
walk into the door and say, you know what, that's a woman of color right there. She angry, she aggressive, she this, she that. You don't know me from a can of paint, pimp.
Right.
You don't
Right.
know me from a can of paint. You just basically said what you thought it was because of what you saw Nicki Minaj do on TV, so and so, blah, 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 yak it and smack it, tag.
Did you go?
You know what I'm saying?
Right.
However, I don't want to do the same thing you're doing. So if a white person come in a room with two missing teeth, I'm not going to assume you're from rural America. You do heroin and you probably inbred. I'm not going to assume that. However, what I will do is engage in a conversation to see where you are as a human first.
Mm-hmm.
Then if you are a bigot, then I'm not going to absorb that. Why am I absorbing your problem?
Come on.
That's
So,
your shit. Sorry,
no,
chat.
no, 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 no. First of all, my grandma said, excuse my French, so speak your French. Listen. So this is what I'm hearing for the audience, right?
Yeah,
Because I think that it is important to hear and then digest and then regurgitate so everybody can be a part of the conversation.
sure.
Accessibility is important.
Go
So
for it.
this is what I'm hearing you saying. You are essentially saying that your analysis is on a micro level. You're not
Correct.
talking about big systemic institutional issues. This is one-on-one engagement between human beings. So that's number one. We need to understand that. Number two, in this micro level analysis, what you're saying is that is a responsibility and accountability that needs to go around for everyone. Everyone must hold themselves accountable and responsible, as well as when they are interacting with other human beings. Number three, is that I need to see you as a human being first. I need to give you the benefit of the doubt. And I know that you may not give me the benefit of the doubt when I walk into this space. But even when you are doing that, that is your personal problem. And I
Correct.
am not going to allow you to make your personal problem my individual hell. Is that what I'm hearing?
I need that third one to go on a t-shirt, please, and thank you, because
Okay.
I am not. I do not live my life, and to me, that's the worst form of bondage. In my opinion, that's the worst form of bondage. Living in the shadow of what you think, and I'm gonna let you dictate my attitude because of what you think. Right? I'm not gonna allow your bigotry keep me in bondage by giving you exactly what you're giving me. Eye for an eye equal two blind people.
Absolutely.
An eye for an eye equal two blind people. Now I understand the rage, chat. I understand. I understand why people, and you know what? I am not asking anybody out there that you are responsible for teaching people how not to be a bigot. Leave it to the folks who want to do it. There's people who want to do this work. I'm one of them. Leave it to people like me to do it. You are tired, sis. You are tired, bro. Whatever you are, you do not have to do that. But you divvy that off. You delegate that out to the people who do. And that's why, going back to the conversation we had earlier, there are the resources
Mm-hmm.
that are out there for folks that can do that type of stuff. You know what I'm saying? So yeah.
Now here's why I'm just gonna I'm gonna not play devil's advocate. I hate that. I'm gonna be maybe critical friends, right?
Go ahead.
And so, what about folks who say, well, I don't see color,
Oh my God.
I don't see gender,
Oh my God.
I don't see ability or age,
Mm,
right? I am blind to all those things and I see humanity first.
mm,
And they
mm.
use that as a way of avoiding,
Oh, that's so cute.
right? So what do you say? What do you say to those folks?
That there's more probing as a therapist that I would do for something like that. If I had a client like that, or if I was even engaging in conversation with a friend that thought that way, I would probe further.
Mm-hmm,
There's not a tactic, a one set tactic for situations like that, because everybody has their story of why they don't see color. But the thing is, why don't you? Would be my first question.
mm-hmm,
Why? You think it's just you that looks, do you think, like, what is the senses behind you not seeing color?
mm-hmm,
Like, why do you turn a blind eye to gender? Why do you, like let's walk through that, because when I start to probe you on that, I
mm-hmm.
now get a bird's eye view on what your life was like. And again, that's me staying in the human space.
Right.
I need to know what your walk was
Mm-hmm,
before I make the judgment call. And so I'm not leaving the human space, but I definitely don't agree with the senses when someone says that, because you should see color.
mm-hmm.
Period.
I love the fact that that is a t-shirt. I live in the human space. I'm not leaving the human space, right? Now, what you do is your business, but this is where I am because in this space, I can control this, right?
Not just that, Doc. Me being in my human black ass mind in my own black ass business space is my choice. I woke up beautiful like this, black like this, chilled like this, and because you got a problem with it, why am I absorbing that and making that my business too? As if my load ain't already heavy.
Mm-hmm.
And as a professional, I can professionally say that, to me, sidebar, people who think like that, it gives me chills. I thrive off of conversations like that, because for me, nothing gets my gears turning than a person that tries to actually get you riled up on a race relation issue, when at the end of the day, all you're doing is spewing stuff that we've been conditioned to think. You're still in the matrix. You're still in the matrix. And until you bring your ass up out of here, you're going to keep being in this matrix over and over. When will you get that you don't have to be here? You don't have to give that energy back, baby.
Right.
You can walk away. You can do a lot of things, babe. And I'm talking the micro level. Big picture stuff, completely different conversation, right?
Mm-hmm.
But at the end of the day, human to human experiences is how we begin to dissect who's for and who's against solving the issue. Period.
That sounds like, and I heard a brother say this. I wish I could quote who it was, but it sounds like just because they're your color, they're not everybody
Your
that's your color
kinfolk,
is not your
your
kind, and
kinfolk,
everybody that's your kind is not your color,
or skinfolk.
right?
All skinfolk ain't your
All
kinfolk.
skin folk ain't kinfolk, right?
Mm-hmm.
So that part, right?
Mm.
So shout out to the homie over here on TikTok, man. Congratulations on everything you're doing. We have a politician over here on TikTok, and she has joined with us, my good friend D. And so, listen, I'm speaking that you're going to make waves, honey, on the north side of Houston,
Yes,
and
yes,
that
yes.
you are going to this is going to be the best season of your life, sis. And so I just appreciate you being here. And if anybody is on TikTok and you see her, I need you to donate to her campaign. She is running for election. When is it? The election is coming up March 3rd, right? So I need y'all to get out there. She had to pay for those door hangers and the stickers and all of the things. So I need you to donate to my good sis over here on TikTok. I need you to follow her and make sure that you're supporting her, especially if you're in the Houston area. This is one of the most genuine human beings I've ever met in my life. So thank you for being here. I love you so much. So I think with this conversation, first of all, this needs to be a two-parter. Let me just say that, okay? Because we are 9 minutes over time. I think I want to end on this, right? Because first, let me do a recap. We have talked about hijacking equity in the mental health space. We have then been able to analyze this, but this particular conversation is being framed in the micro level,
Mm,
which means that we're talking about individual, right? This has really been a symbolic interactionist conversation about small groups of people, patterns within those small groups of people, and then individual interactions.
mhm,
How those individuals then take things in society, symbols, words, language, whatever, and make meanings and associations with those things. We've also talked about how these individuals have been psychologically conditioned and socialized by their
mhm,
environment. So, this is nature and nurture.
mm.
How there has to be a responsibility and an accountability when you are walking into a space to then dissect what your particular psychological issue is, especially if you are walking into a space to then have a better understanding of yourself and how you are showing up with all of your things, all of your identities, and how you are to then have a better understanding of others when you're interacting with them. And what I have heard Counselor Frazier, soon to be Dr. Frazier, say to us tonight is that your the first thing that you need to do, the most responsible thing and divine thing and human thing that you can do when being in a space is that you have to interact with human beings first. Lay all of your things down, see yourself as a human,
That part.
and then see others as a human, and then allow that to guide and dictate the interaction. Did I surmise that the right way, Doc?
You did, Dr. J. But to lay on one thing, be careful what you absorb. That's
Okay.
the thing. If you were to do these things, especially from the clinician's point of view, right? Because from the micro level, that's how I do therapy. One on one, small groups, micro, boots on the ground. Because if we're going to attack the macro, we must first start with the micro, right? We cannot build big ant hills without first training the ants.
Come on, sis.
Period. Right? And so, but you got to be careful about what you absorb because you're going to be, as everybody in the chat will know, we're going to be met with conditional thoughts from people who have been conditioned to think the way they think. And it will rattle you. You are human. You have the right to be mad, emotional, all the things, right? But how you actually get that, break it down, and use it for fuel is where you become the different entity. You become the dangerous one because no matter what they give you, and you know who them theys are, right?
Absolutely.
No matter what they give you, if you continue to stand on your if you stand in your square, if you
Right.
stand in your square and you know who you are, you know whose you are, everything else, as far as the bigotry, the systemic everything, becomes a personal problem to that entity and not you. You become the stronger entity within the room. Now you become a real problem. Now you become a real problem. And when you become a problem, especially in that way,
Mm-hmm.
you can actually make some shit shake. You can make some shit shake. And
So
that. Mhm.
yes. So let me for those of us that are still on, thank you so much for still being here. Let me break down what she said. When you say step in your square, so you got to be from a certain neighborhood, from a certain culture to understand
Facts.
what that means, right? Step in your square, right? So that means that you standing on business, you 10 toes down about whatever is happening with you at that particular moment. I'm just looking at two cameras right now, but I'm getting good at this thing. Come on. Right. So when you stand in your square, that means you standing 10 toes down about yourself, right? I think it was Juanita Biden that said that y'all got to you got to face it, you got to square up, you got to look it right in the eye and not blink, right?
There you
That's
go.
what you have to do. And the other thing is that leans into this conversation about when fairness feels like a threat.
Right.
When you're clear about who you are, when you are clear about whose you are, when you are clear about and you walk in confident and you are unbent and unbowed and you can't be shaken and what you are doing, that's when it becomes this different kind of conversation where you're condescending. Oh, I'm speaking about my own personal experience, not my God. Oh, you
Mm-hmm.
condescending. Oh, she uppity. That's what that means. You're an uppity Negro, right?
Mm-hmm.
Or she don't speak to people. That means that I just don't allow my energy to be exchanged, right? Frivolously. I don't deal with frivolity, okay? Right? When I am in this space and I know who I am and
Mm-hmm.
my back is straight and my shoulders are square and I'm looking you dead in the eye, that danger is not because I there's something wrong with me. That danger is because I'm stirring up something in you, whether it is incompetency or insecurity or whatever it is. So that's when I understand what you're saying. Well, that's not my problem to have. That's yours. That's a personal problem. You need to address that.
Exactly. That's what makes doing race relations very easy for me. Like
Mm-hmm.
I have had forward conversations with outright racists
Mm-hmm.
who are diehard good old boys.
Mm-hmm.
I have no problem with having conversations. My mother used to ask me all the time, how do you have these conversations? I don't see how you can stand it. Because it's not my problem. It's not my problem. You know what I'm saying? And so because it's not my problem, I'm not gonna sit here and fold with you in terms of that energy and get angry.
Mm-hmm.
What am I doing that for? I'm not your sponge.
Ooh,
And why you're mad because I'm not coming down that road with you. That's why a lot of
yes,
them get mad. And so when we
absolutely.
start thinking from that lens, we can navigate white spaces better.
Mm,
We
mm,
won't, we will not, we cannot, we, the thing is, and let me just say this, chat, as a caveat, it's tiring. I'm not going
yeah,
to take that away from any of us. It's tiring. And we are tired. Listen, look what's going on in today's government right now. We the black community are taking a seat with our fans and we chilling at the cookout while all this stuff is going on because we's tired. And I get
mm-hmm,
it. I
mm-hmm,
get it. You know what I'm
mm-hmm.
saying? But the truth of the matter is, you're still a human being that got to get up and go to work every day and feed your families. So those
Yes,
finite experiences that we have to go through just to make sure we pay the bills and keep them lights on, that's where all this information that I've talked about tonight, that's where it applies. It
absolutely.
applies there. Now your government and all those big plate issues, again,
Right,
a whole nother conversation on a whole nother day. But all the
absolutely.
information that I've given tonight talks about the human experience, the individual, you, the individual. How do you handle white spaces? How do you handle racist situations? How do you handle what's your behavior? And I don't mean you need to straighten up and fly right just so you can keep your job. No, what are you absorbing? And what are you not absorbing? What's your problem? Why are you making this your problem when it ain't your problem? It's never been your problem because we ain't never asked to be here.
I think that in these last 3 minutes, right? We're gonna
Mm,
wrap for everybody who has hung on with us, right? We in a
thank
few
you.
minutes. Thank you so much. But when you get into this kind of conversation, like first, you want to, one, let me be very honest. When we do these kinds of interactions, we want to show up, right, as our representative. And then as the conversation goes on, we start taking off that mask that Paul Laura's Dunbar talks about, that grins and lies, right? And so now we are in this space, right, where we're really having a dynamic conversation, an authentic conversation, right?
Hmm.
A necessary conversation, right? Good night, Jin Jin. Mama loves you. And so that's it. So the other thing that is that there may be some sisters, some brothers that say, I think you are uh, two roads diverged in the yellow woods, right? And I think you're going to the right, sis. We're supposed to be going to the left when you're talking about now really divorcing from this process of taking in and internalizing these things. Like we just have to take it. That is a part of the struggle, right? Without struggle there can be no process. And so I really don't agree with you saying, Dr. Frazier. i
Hmm.
think i think you taking this a little bit too far. Like how are we supposed to do that when it's always been done in a different kind of way?
Mm-hmm. Well, you go ahead with your knowledge, sis. That will be my response. You go ahead with your knowledge and let me know how far you get with that. Because see, you remember Moses and how he took a road less traveled. You remember how a lot of the disciples had to walk the wilderness in order for them to understand what their true meaning of calling and purpose is. Me, when a person tells me I'm going this way when everybody else is going this way, I purposely do that.
Absolutely.
I purposely do that because as a person, he who takes the road that's rocky tends to acquire the answers and the wisdom to keep these answers. You know what I'm
Mm-hmm.
saying? Because it's
Mm-hmm.
one thing to acquire the answer, right? But to be able to acquire the wisdom to get the answer is a completely, totally different story. So a person that and trust me, Doc, I've been told that all my life. I always go against the grain. When I find more people, black people, mad about the whole whatever happened to this person of color, blah, 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 everyone's in an uproar. I'm usually, why are we shocked? That's usually my response. What are we shocked about?
Mm-hmm. We've seen this before.
We've been here. This actually been going on before we were here. Why
Same
are we
playbook,
shocked?
same movie.
Same script, different cast. Why are we shocked?
Yeah,
What we should be shocked about is why we ain't do nothing about it yet.
absolutely.
Why we ain't had these tough conversations yet. That's where I live, right? And so, like, yeah, sure, I invite those conversations when someone thinks I'm taking it too far or going the different road. I invite that conversation because tell me how, Sway.
Hmm.
Tell me how. And that way, that's a whole nother conversation. And hey, listen, I don't claim to be right about all this stuff. Teach me something, brother. Teach me something, sister. Whatever it is, I will definitely take that in and consider. Because
Absolutely.
you are human. You have a right. And I understand that as a clinician and a human being myself, you also have a human experience. You deserve to be heard, and your feelings deserve to be heard. So whatever it is that you are feeling in terms of why you feel like I'm not taking the best traveled road, I'd love to hear that.
Mm-hmm.
I
Mm-hmm.
embrace that.
Absolutely. It has been, first of all, I hate to cut off this conversation, right? So listen, y'all tap the screen over here on TikTok. We haven't, if you like the live, tap the screen, tap the screen. Let's get us to 1,000 likes over here. We had 663 likes on TikTok. Come on, let's do the thing. For all those of us that are still here on LinkedIn and who stayed on with us, we're a little bit over time. I do appreciate your presence. I do appreciate you being a part of this conversation. For those that have been in the chat, and I appreciate you. This conversation is necessary, and I hope that there's more to come. Absolutely, it is. I do appreciate you, Claire Miller. I saw you in the live. Shout out to Dr. Johnson, who was on here with us. Shout out to Michelle Harper, who was on here with us. Man, shout out to everybody who we. So let me just say this. I sent out the link thinking it was the link to the live when it was actually the link to inside of the studio. So we actually had a full studio here tonight.
And
So what
people,
is the
my
next
folks couldn't
episode
even
coming?
get in, Doc. I had
Yeah,
folks that couldn't even get in.
we had a full studio here tonight. So let me say this. We are going to continue this conversation next Wednesday, 7 p.m. That is July 4th. July. I'm already in the summer. That is
Girl.
January 14th, 2026. We're going to have the conversation. It is called The Reframe and the Arrested Development of Language. So join us here on TikTok Live as well as on LinkedIn Live for a 7 o'clock conversation. It's called The Reframe. This has been Hijacking Equity. I am Dr. Relia Johnson. I'm so grateful for my former student, my love, my Shiro, man. Like you are just amazing. The soon to be Dr. Zahiyah Frazier. We will check y'all here next week, same bat time, same bat channel. Let me be very clear. We only have 9 episodes. We've done one, we have 8 more. Next week, 7 o'clock, Wednesday. It's called The Reframe. We're looking at the arrested development of language. And we will holler at y'all later. Listen, I got to figure out how to do all the things, y'all. Oh, tell them where they can find you one more time, Zay.
Please hit me up on She Is Z on Instagram. That's the best way to access me in terms of all things therapy. She Is Z on Instagram.
So we're gonna end the live. Zay, stay on. Thank you so much, y'all. We'll talk to you again. We're gonna get the bugs and the kinks out too. All right, it's your favorite sociologist. I'll holler at y'all later. Peace.